This is a Rogue Media Network production.
Welcome back to the show. You know, there is a Valentine's event that is coming up. It's one we look forward to every year, and it's going to bring people together for good and a good time. And we're talking about the Morticians Valentine's Day dance, and the wonderful Van Davis is here with us, Betty Edwards with Morticians, and you know, it's just a tradition. So here we are. Tell me about, it's going to be on Valentine's Day on Saturday.
And I think we're so excited that it is going to be on Valentine's Day.
I know.
So
Right.
you have no excuse. It's time to, to come out and put on your red or pink or anything you want to do, but to come and have a great time with us, good food, and of course the best music that you're going to find in Waco. That's with Morticians
you.
and
Thank
Buddy. Yes.
Appreciate that.
Well, buddy, you know, it's always fun to hear the Morticians. And so tell me, the same personnel we're used to
Same
seeing?
personnel that's been with us a decade now. So
Yeah?
we've been real lucky. We have a really good lineup of folks working in the band, and we enjoy it and have fun. We are glad that other people enjoy it as well.
Okay, and the venue is going to be at the Palladium.
That's correct.
Which is right down Austin Avenue, across the street from the Hippodrome, if you're not familiar. Great spot for a dance, and we've seen you perform there several
Yes.
times.
And plenty of parking too. You know, people often worry about where are we going to park
Right.
downtown, but there's plenty of parking spaces around. So we're excited.
Well, Van, it's always fun to be there with you and to have fun at this, but it's also going to help raise some money. Tell us about the benefit.
Well, this is the third or fourth time we're doing this together. And the Waco Family Abuse Center is going to benefit from this event. And also, near and dear to my heart, our awesome pickleball outreach program that can serve the community even more through pickleball. So we're excited.
Of course, you've been on the show many times talking about pickleball, and you know, it just tickles me because you have, you know, picked this up really just in recent years and fully embraced the sport of pickleball.
Well, to me, when God, just gives me an idea or introduce me to something new, and it stays with me for a couple of weeks, I know that's something I needed to do. So the idea, after I played, I fell in love with the game, and it's like, how can I bring the community together to do this wonderful sport? And it's been amazing. We've served over 1,500 people through pickleball, and we want to continue to do that even more. But the Waco Family Abuse Center that we've been a part of for many years, and we want to definitely continue to help them out. And it's going to be just a fun event. We used to, I know you and I, Ann, we used to go to the Valentine's dance at the convention center with the Morticians for many years.
Well, I've been one at the Lion's Den, I think. I mean, I go way back
You
with,
go back a little
with the
ways, yeah, that's
Valentine's
right.
Morticians dance. You do the hamburgers and all that sort of thing. And then one of the last ones we went to was at the Baylor Club. And that was before you were going to have your big birthday, and you were talking. So this has been sort of a tradition for my husband and me as well. The Morticians, though, are just a wonderful, iconic band. For anyone who doesn't know, tell them the
Sure.
origins of
They go
the
way
Morticians.
back.
Well, they do go a long
Yes,
time.
and try to remember the origins, but actually it goes back to about the middle 1960s. When the original Mortician band was formed, when the kids were in high school.
That
with
was
the old-
Richfield, right?
Richfield, yeah. And they played for, 2 or 3 years there while they were students. Then, of course, graduated, dispersed. And then in about 1982, a couple of the original members of the band, Danny Moore, who was the original vocalist, and Joe Hall, kind of got the idea that it would be fun to play some of the old tunes again. And we brought in a couple other, I was fortunate enough to be part of that group. Kenny Gradell was on drums, and Mark Venable was on the bass. And we played at the old waterworks one time, and the crowd went crazy.
And you
we
thought, we got a thing
Just
here.
like
we
the
got a
Beatles.
thing here, and that was 1982. So
Yeah.
we still got a thing. So
Yeah, you do.
but it's been fun, and we're so glad the community has enjoyed the music over the years, and it's been so much fun to play those old tunes.
Yeah, of course, you have some traditional things that happen at these dances, right? Because you're kind of organizing things. And we mentioned the hamburgers, so what is the food going to be?
We're going to have an Italian meal catered by the George's Catering.
Okay,
So
good.
we'll have people can have a choice of spaghetti and meat sauce or Alfredo, and there'll be salads and cheesecake and and an open bar as well for
Okay.
those who need a little encouragement to
Or can
dance.
people BYOB if they want to bring their own wine, or what? How does that work?
We have not thought about that.
Okay.
I would imagine so. I mean, we used to do
I
it
don't know.
before, but we would want to encourage people to come however they want to come, and just to come for a meal, or if they don't want to come and eat, they can just join us when the dance starts at 7:00 and just pay to come to the dance.
Okay, so give me the timing again.
The timing is if you're there for dinner and dance is 6:00.
6 o'clock,
6 p.m. Dinner will be served. Doors will be open at 5:30,
Okay.
and we'll start dancing at 7 p.m. So people can come at 6 and have a nice dinner with us, or come to the dance itself.
All right, and so the cost?
The cost is $45 per person for dinner and dancing, and $30 if they just wanted to come and do the dancing that evening.
Okay, so but can they buy tables, or is it all just individual
Yes,
tickets?
absolutely. A table of 8 to 10 will be available on first come, first serve basis. And when you go online to sign up, you can just request for a table together,
Okay.
or just come and you can just show up at the door and buy tickets as well for the dance.
Okay, so but for the meal, you need to do that ahead of
The
time.
meal, definitely, you need to do that ahead
So
of
you
time.
can have a head count. So tell me, buddy, after all these years, what makes you still so passionate about playing?
Well, I think it's in the blood at this point.
Yeah.
And I remember when I was in high school and just learning to play the guitar. The original Morticians, I was sort of their groupie, and I went to all their performances. I didn't know the kids really that well. They
Yeah.
were playing then. But I think once it gets embedded in you, it's just a lifelong thing.
Yeah.
And so I've always enjoyed playing those songs, and I enjoy playing other types of music too. But it's just been something that's been with me. This has never dispersed. It's still there. So.
Well, Ann and I are your groupie.
Oh,
Yeah,
well, thank
yeah,
you.
right.
I
We're
appreciate
your
that.
We're part. There are quite a few of us, So, are there some other games and things you're planning for that evening?
Well, we're of course going to do the heads and tails.
Oh,
So
yeah.
always a lot of fun, and you can help me with that.
Okay, I've promised to
and
do
we'll
that.
we'll have some raffles and things going on at the same time too.
Okay. Well, and again, it's a fun night. Going to be great food, great entertainment, and a way to help a wonderful organization that helps
I
really
think-
unfortunate folks.
Right, and I think the biggest thing is, personally, I would love to continue doing the annual Valentine's dance with the morticians like we used to have. And but while we're going to do it, let's do it for a good cause as well.
Oh, yeah.
So we're excited, and Buddy has always been, and the band too, gracious in helping us out and being a part. And what a better way to celebrate Valentine's Day and bringing the community together for a good cause.
Okay.
And
So
may I add real quickly, I would encourage people to come who maybe are not dancing so much anymore.
right.
If you want to come and listen, that's perfectly fine.
And it's not so loud that you can't
That's
visit.
right.
I mean, that's what's
That's right.
good. Is it that it's just perfect as far
Right.
as that goes? Because
Sure.
there are some venues where it's so loud you can't hear yourself think. It's so
Just if it's too loud, just say turn it down.
you're pretty responsive. Will you still have the? Can we vote on whether or not you do "Smoke Gets in Your Eyes" or "Unchained Melody"?
Oh, I'll let you choose the two songs, Anne, and definitely people can vote on what you would like to hear on after the second
Is
set.
well, no, it was "Pretty Woman" or "Unchained Melody."
I
wasn't
think
that?
you
Yeah.
got it. That's
Okay.
right.
Yeah, we always have like the faster song or the slower song, and for some reason, the slower song always wins out.
wins.
Yes.
Well, there's this anyway. It's a wonderful evening. So the best way to go and find tickets, where do you find them?
You can go on Facebook. You can go to Be Awesome Now. You can go to Van Davis. And the Morticians has a Facebook page as well, and we'll put some links there that people can sign up. You can call me directly. You can message me. You can contact Ann.
That's right.
We're all going to find ways that you can
we'll
get tickets
find
for
ways to
sure.
get you tickets.
Yes.
Well, it's going to be loads of fun.
Thank
you.
We will have a lot of fun.
Definitely.
So this weekend, Saturday,
That's
join
right.
us.
It's coming
yes.
Friday. It is Valentine's evening. So what a great way to enjoy with your sweetheart.
That's right.
Thank
Even if you don't have a sweetheart. You
Oh,
can
come and enjoy the
yeah,
music.
come and join the music,
That's
and
right,
we'll
there'll
have
be
we'll have
plenty of
singles
people there.
together, and
Yeah,
they can dance
Oh,
together.
absolutely, absolutely. All right, thank you both so much.
Thank you, Ann.
Thank you
Stay
very
with us. There is more of the show ahead.
So it's football season, and we can create your outdoor tailgating spaces that is actually a part of your home. Bifold doors that tie in the inside and the outside, and you can gain anywhere from 1,000 to 5,000 square feet living space, all while taking in the big game poolside. Call us at Gather & Co. Kitchen and Bath, where we can create your unique tailgating space.
Central Texas since 1889, TFNB Your Bank for Life takes pride in being more than a bank. At TFNB, we remain committed to these principles. If you value them too, come join us. TFNB, Your Bank for Life.
Ready for a better kind of primary care?
At Patient First Direct Primary Care, you get unlimited office visits with same-day or next-day availability.
And instead of rushed appointments, we take the time to actually listen.
There are no insurance hassles, just clear, simple care.
You can reach us by phone or text because access shouldn't be complicated. Our practice has expanded to include Medicare-age patients as part of our direct primary care model.
It's a fresh alternative to the traditional insurance or government-driven systems, care that finally puts you first.
For more information, go to patientfirstdirect.com.
Farmhounds offers natural treats and chews made with quality products that support family farm, regenerative agriculture, and humane farming practices. Give your dog the best with wholesome, organic ingredients that promote health and happiness. Shop now at farmhounds.com.
My house has a new glow. I love my windows. Universal Windows Direct. I let in the sun rays, more of the heat stays. Universal Windows Direct.
Right now, buy one window, get the next one free, plus no interest and no payments for 24 months.
I love my windows. They've got that brand new home effect. Universal Windows Direct.
The reason that their service is outstanding because the people they have working, behind the desk and the folks working out in the garage, taking care of business. And they give you a date, they give you a time, and they're spot on. And they're professional, they take care of it, and they answer all your questions, and they're fun to work with.
Like Alan Samuels always said, Waco has a lot to offer, and so do we at Alan Samuels Dodge, Chrysler, Jeep, Ram, Fiat. Come by, let's be friends.
I am obsessed with helping business owners increase their traffic and turn it into profit through the power of Pinterest marketing. It's this amazing platform where people are looking for ideas, inspiration, they have a problem, and they're actively looking for a solution.
Walking along the
hard to find supplements that work. No, thank you. Plant-based supplements made from the Earth's most powerful plants for your immune health, gut health, workouts, and more. Find out more at auraorganic.com.
It's the Restore Clarity Focus Patch, my little secret weapon for staying sharp, focused, and on task. Each box comes with simple instructions inside, so you always know exactly how to apply it. Each patch lasts for 3 days. I love that I can wear it all day.
Finance is evolving. Automation, data analytics, and AI are reshaping what finance teams do every single day. The best way to predict the future of finance is to be ready for it. If you want a head start, check out 365 Financial Analyst.
Hello, everybody. Welcome to the show. You know, when we talk about healthcare, we focus on diagnoses and treatments and outcomes, obviously. But there's another element that really deeply affects all those things on how patients feel, how families cope with the situation, how communities build trust in their healthcare systems. And that's patient experience. And it's more than just comfort and satisfaction, which you might think. It's about safety, communication, dignity, and feeling heard during some of the most stressful and vulnerable moments for someone. Well, today I'm so happy to have Kerri Reyes here with us. She is the Patient Experience Manager for Advent Health Central Texas. And Kerri, you work in the intersection of care and communication and compassion and helping ensure that that patient experience is the best it can be. So
I do.
Lovely to have you here. I had the chance to interview you for Channel 25, Advent Health being one of the sponsors there at KXXV. And really, it was the first time I've had a chance to talk to someone who really specializes in this area of patient care. I mean, we all take the survey, you know, no matter what, you know, how long did you have to wait? You know, those kind of things. But really what you do is a lot more detailed than that.
It is, and this is a newer role for Advent Health Central Texas specifically. I got into my role October of 2023.
Okay.
So prior to that, we didn't have anybody in patient experience. It was just up to the leaders to manage all of the things, not just complaints, but also how do we make improvements with that feedback that we get. And that's why the survey is so important. You know, patients think it's just another survey. You go to Walmart, right? You get a survey, 5 stars.
Yeah.
But it means a lot more than that, because that feedback helps us improve processes to make things better for the next patient.
Mm-hmm. What are some of the most important things you learn from those surveys?
Most important things we learn from the surveys, and I'll speak about right now, is that we aren't listening to our customers or our patients. We're not spending time with them. They feel that healthcare is rushed, that we drop in, drop out, give them a quick diagnosis or not, right? Sometimes you go in, have all the tests, they're negative, and nothing's wrong. But
they don't know. But I know I'm sick, but we can't find anything.
Right, and we don't take the time to sit down and say, hey, you know what? I'm glad you came in today. You didn't have a heart attack, but this is what you're going to do moving forward, and this is who you need to follow up with. So then patients almost, it's like we, not intentionally, but make them feel bad for why they came in because it wasn't a true emergency.
Yeah, it's kind of like you take your car into the into the shop, and it's like, I promise you it's going, you know, and then of course it's
it's fine that day,
it's
right?
fine that day.
Yes. So we're learning that it's not just about wait times, right?
Yeah, right.
You know you're going to have to wait. It's that we didn't keep you informed while you were waiting, or we didn't keep you updated. And I teach my staff, you know, no update's an update. Patients don't want to feel like they're just left in the corner and not checked on, right? We need to be frequently checking on them, frequently updating them, and not only the patient, but their family is a big part of that. And we need to address them too. Hey, you know, they might be diabetic. Do you need a snack or something to drink?
Right.
Maybe the patient can't, but you know, their family member that's been there for 6 hours with them, right, didn't have anything to eat, and we don't want her, you know, having an emergency on top of that. So, and I'll tell you, with the new guidelines for CMS and quality, as we relate experience and safety together, the guidelines coming out for 2026 are very heavily involved with patients and their families.
Okay, so I didn't know you have rules and things that you follow. So tell me more about that.
We do. So required starting this year to have a patient and family experience council. So that's not only workers or staff members, but also people in the community that need to have a say in how we operate. When our doors open.
So every hospital, no matter what.
Every hospital, if
Okay.
you participate in, or you can get reimbursement from CMS.
Okay,
It's
so
gonna be
what
a
does,
requirement.
what does CMS stand for? I'm sorry.
The Centers for Medicare and Medicaid.
Oh, okay.
So how we get paid for,
Yeah.
there are some private hospitals that, maybe not utilize that, but most hospitals in our country are a part of that.
Mhm.
And they're requiring us to really make efforts to include them in our decision making, shared decision making. So it's a big part of some of the things that we have to do, like change the verbiage or make sure we have signage out or make sure we have a link on the website to know, so our patients and their families know that they are included in some of those decisions.
Mhm.
Or how can they be a part of that shared decision making?
Well, yeah, because people do. I mean, hopefully, physicians are happy that people try to be as informed as they can be. The old, I don't know where my phone is, but Dr. Google.
Oh.
A lot of times like, do not go online and read anything about what. But then in other cases, you can't help it.
You can't, and
If
I'll
you
tell you,
wanna-
even as a nurse for 15 years, I do
Okay.
Google, okay? But I do not recommend it to my patients. I try to tell them, get your information from somewhere, not just from Google, but go to WebMD. Really, honestly, you should check your primary care. A lot of, I know Advent Health specifically, we have a care advocate, and you can go on the app and just text her a question, and I say her, text the bot a
Yeah.
question, and then
Yeah.
they can relate you to a team member, a nurse, a doctor for those questions. But some of that can be answered just with the bot,
Right, with a text,
Mhm.
or maybe you want to talk to a human being about. Yeah. So why is patient experience especially important when patients may be feeling anxious or vulnerable? Worried.
Patients aren't just a number, right? We are
Right,
humans,
right.
and they want to feel loved, cared for, heard. And a lot of times, especially like we were talking about earlier, those negative, all the tests are negative and nothing's wrong, but we still need to sit down and have that conversation
Yeah.
and
Well, then
explain
why
the
does my gut hurt? Why
Right.
do I
And
hurt?
then stress that importance of follow up.
Mhm.
And that's where, and I'll say in Colleen specifically, we see a lot of where our community is uneducated, or that they receive the wrong information, or they seek the emergency care for more primary care issues.
Right.
And so part of us marketing and trying to get it out there on what's important, when to go to urgent care, when to go to the primary doctor, when to go to the ER, so that we can, we see 150 patients a day in our ER
Do you
in
really?
Colleen, and not all are emergencies, but we still need to take the time to make them feel good, educate them, make them feel heard, again, so that they keep coming back, right? It is a consumer business, and somebody once told me if we're nice to all the patients, they'll always come back, even the not nice ones. I said, well, we've got to be nice to everybody.
Well, some people see medical care as separate from patient experience, but often that patient experience can affect the actual medical outcome. Tell how that works.
It can, and there are lots of research and evidence-based studies about how having faith and trust in your healthcare provider improves the care outcome, improves the discharge process, improves the opportunity to follow up. If they trust you and they felt loved and cared for during their stay, they're more likely to do those things. And that affects readmissions, which goes into those KPIs that we utilize. Patient experience is one, mortality, readmission, and safety. So keeping our patients safe goes a long way with that experience as well. And we're held accountable to those numbers. CMS holds us accountable to those numbers. Our reimbursement is affected by those numbers. And I didn't really realize until I got into this role how important it was. As you talk about satisfaction and numbers, but humans are more than a number. They're a person.
Yeah.
And they seek us for care. And so we have to be more empathetic in our conversations with them in their education. You're always going to have your, select few that come, they're lonely. They want to come once a week and seek out care. And that's fine. But we need to treat them with the same empathy and compassion as we do the payer patient, right? With private insurance. We have to treat everybody the same consistently. And that's a big part of where Advent Health, we're showing our staff members how to love one another, keep each other safe, treat us with empathy and compassion, not only each other, but our patients. We want that as human beings, not just a number. But I hope in my role that I do help to support and not only educate our teams on patient experience is not just a number, it's not a thing, and it's not going away.
Right.
At all. It's not going away. I talk about it like are you going to, if you're traveling, are you going to stay in a 2-star hotel or are you going to stay in a 4-star hotel? Right? What does the 4-star hotel offer? It offers better amenities, better breakfast, buffet options. And that's what a 4-star hospital is going to give you versus the 2-star hospital.
Right.
So when you're traveling and you need to know where the closest hospital is that has great safety numbers and keeps their patients safe and informed and their patient experience is good, that's where you're going to want to go to seek out care. And I'm proud to work for Advent Health, or an organization that.
Well, I've learned so much about Advent Health in the couple of years that I've been privileged to do those interviews for Channel 25, and love so much really the mission behind Advent Health, because it is definitely a faith-based organization. Let's talk a little bit about that.
Yes, we pray before, I want to say, 99% of meetings, we have devotion and prayer. Our daily safety brief we hold with leadership every day. Prayer, and there's some that don't feel comfortable praying, and that's okay. We can call the chaplain or someone else that's more comfortable praying with the patients. But having God, around, it's nice to work in a faith-based organization that allows us to do that, to pray if you want to pause, right? To help patients understand that a higher power does help them indeed get better, right? Or helps them follow up after they leave the hospital. That's a really big part of Advent Health.
Yeah, he is the great physician. And yes, absolutely wonderful to know that Advent Health Central Texas believes that and encourages that. Because, when you're worried about your physical body, if say you have some sort of, traumatic thing happen, but your spirit is certainly a big part of that. And to have people who are like-minded, faith-wise, taking care of you is pretty important.
Yes, our mission is to extend the healing ministry of Christ, and it should be in everything you do, whether you're helping a patient get to where they need to go because they're lost, or you're rescheduling them for an appointment that they were late for, right? No matter whose fault it was.
It happens.
It happens, and I can say that as I'm late to most appointments. But it should be in every walk of life. Everything that we do should be faith-based and helping extend that healing ministry of Christ, just like Jesus did.
A lot more I want to talk to you about, Kerri, regarding trust and communication, and we will do that, but we need to take a break right now, and we will be back with more of the show. Stay with us. That's so good.
How long have you been doing this?
Since I've retired from Channel 25, so I'm going to be doing almost 6 years since I retired from 25. But the Ann Harder Show every day, Monday through Friday, just started in June.
Okay.
But I'd been doing 2 or 3 interviews a week, so it just added a few.
Yeah.
But I record them, certain times,
Right.
and then so anyway, here we go. And we're back with Kerri Reyes, who is the Patient Experience Manager at Advent Health Central Texas. And it's a whole kind of a job area that I really wasn't aware of, but it is so important for a number of different reasons. From the patient, obviously, the patient's family, the healthcare team as well.
Yes.
Are all involved.
Yes, and I'll tell you that even when things don't go right, the CT machine breaks down, right? Your appointment gets bumped. Epic goes down, and we have to use our processes that are downtime processes. When those things don't go right, and we do service recovery, that's what we call our model for, we acknowledge or apologize, correct the issue if we can, and then thanking the patient for bringing it forward. When we follow that, and that starts with the frontline staff, they're more likely to trust us and return back to our hospital even when things didn't go well.
Mm-hmm. Well, it was funny. We were talking about how so many procedures are done with robotics.
Yes.
And we're all talking about AI, and I thought, well, at least AI is not gonna, be giving you an appendectomy. Oh wait, no, it may very well be doing that. But then somebody said, well, what if the power goes out in the middle of the procedure?
That it happens. It's happened before, and we have processes in place to help that.
That's good.
Right?
That's good to know.
We do, and we actually May will be a year. We have the DMV5, the most, the fastest, bestest robotic on the market.
Okay, so tell me about that.
So we did the ribbon cutting back last May 2025.
Right.
We do some gynecological procedures, and we started out with urology and gyno. So those physicians that are trained, and then the plan to get more physicians brought in and trained to utilize that machine.
Mm-hmm.
So it's going rather well. There's a lower downtime with procedures using the robot because they're more accurate, right? Versus,
And
hands.
this is like for hysterectomies, that kind of thing?
Hysterectomies, prostate things, smaller, and there's still, maybe you spend 24 hours in the hospital, a night of observation, but it's so precise that it can decrease your downtime after the procedure and get you back on your feet quicker.
Maybe not as invasive as the old way.
Right.
Yeah. So communication can really make or break a healthcare experience. How does clear, compassionate communication from check-in to discharge shape that patient trust and understanding?
It really does, and I know I said this earlier too, but it really impacts the way that they see us, that trust for them to follow those aftercare instructions, follow up with primary care, and then the healing process actually is faster. There's a lot of evidence-based practice related to that when they trust their care providers and they feel safe with them, that they follow the instructions and do the things that they're supposed to do. And again, you're going to have your outliers, but patients want to feel like even if we explained everything or they were a little out of it, they have it ready to take home at hand. Okay, hey, we went over this.
Right, because they may just be coming out of anesthesia.
Right.
Hopefully you got a family member that's listening with both ears, but sometimes that's not even true.
Right, and including the family in that,
Right.
because we know that when we send you home after your colonoscopy, you're going to be a little loopy. A normal procedure for us that's our everyday might not be your everyday. And the patient that's more anxious, maybe they have a family member that died of colon cancer. So
Right.
for them, this everyday procedure that we do is more impactful to them.
Right,
So,
other fears, are
right,
involved.
and
Yeah.
spending time with them, taking it slow, asking, hey, do you have any additional questions for us? Listening to know when you connect with your patient, you can tell who needs more hand-holding than the next
Right.
patient. How anxious are they? So picking up on those cues is very important, but you can't do that if you don't connect with them. And sometimes that means connecting with them not on a medical, but a personal level, right? And it makes them more likely to listen and take that aftercare instruction advice and to follow up with their care provider.
Yeah. Now, you say you were a nurse before. Let's talk a little bit about that. When did you get into
Yes, I've been a
this
nurse
whole
for
medical field?
15 years.
15 years? Uh-huh.
I'm originally from Memphis, Tennessee. So I've worked at some major hospitals down in downtown Memphis. Methodist, Le Bonheur, worked at the Children's Hospital. That was a couple years old back when. Done a lot of different things. This is probably one of the most joyous things that I've done. It really fills my bucket when I get to help someone or help a team member better understand the patient's perception of care, because although the surveys are based on patient perception, perception is reality.
Sure.
Right? That's
Oh,
their
yeah.
reality.
Right.
And so whether or not it didn't happen exactly as the way you thought it did, but to that patient, it meant everything, right? And it meant if we didn't do well, then maybe they're never going to seek care at Advent Health again, right? And then we lose the customer. So we want to make sure that we're not only extending the healing ministry of Christ, but reaching back out when things don't go well for that service recovery.
So, how old were you when you knew you wanted to do this kind of thing?
So I originally wanted to be a doctor.
Did you good?
I grew up watching ER. So Dr.
I know.
Carter.
Oh gosh. Yeah.
And actually, there was a Carter on the Backstreet Boys, if that was my band back in the day. So I used to sign, in 8th grade, I would sign my papers, Dr. Carter, Dr. Carter.
Did you really?
I did.
I love it.
I did. I met my husband when I was 20. So shortly after that, I realized, okay, well, you know, a career in medicine, I can't have the family and all the things that I want now. So I got a job as a nurse's aide. Back then, you didn't need a license or official training for that.
Yeah, now they have CNAs, which is right. You're certified.
Oh,
to do
certified,
that. Yeah.
yes. But we didn't take vitals. We didn't do, you know,
Right.
some of those medical things back then. But it was a great start for my career. And, you know, not saying I'm started from the bottom and rose to the top, but definitely was one of the best decisions I've ever made was to become a nurse. And yeah, it's been very rewarding.
Yeah.
Very rewarding.
So we talked about surveys. How are all the ways that you gather feedback? How, you know, what are maybe some of the more creative things that you've done?
We really like to gather that feedback in real time, or as in real time as possible. So if you visited RER last night and you didn't have a great experience, we hope that you'd reach out to the patient advocate, which we have one of those as well, and I work very closely with her. So to reach out to one of us so that we can help resolve the issue. If the medication, you know, the doctor said we sent it to the HEB, but it wasn't at HEB. We want you to call us as soon as possible so we can correct the error and make adjustments, because maybe there's a problem with the process, right? And as we talk about safety and care and how that experience goes together, we want to ensure that every patient feels heard and spoken for, because honestly, our inpatient surveys, there's a 6-day lag before even we send out. It's a mail.
Yeah.
We still, in most of the hospitals, even in Advent Health, are doing mail, still doing, I call it snail mail. But,
Yeah, that's right. Right.
but yes, so it's going to be several weeks before we can get that feedback. We do nurse leader visits. Our clinical directors and managers of every unit are supposed to see 100% of patients Monday through Friday.
Really?
To seek their feedback and ask how their care experience is going. Do they feel heard? Is their doctor and their nurse rounding together? Are we communicating well? And asking them using teach-back methods like, did you understand your plan of care? Do you know what the next plan is? And hopefully the patient can tell you, right, what that plan is. And I'll tell you, there's some situations or some diagnoses where maybe the patient can't repeat back. And hopefully there's a family member present, or somebody's just a phone call away, where we can, you know, utilize that teaching over the phone. But in real time as possible, we would like to address those issues. The director or the frontline staff would be the first one to address the service recovery and then escalate it to management if needed. There's been a few times where I get brought in if the manager, you know, said, hey, I did service recovery, but Kerri, I think they're going to need your touch on this, and I'll go and see what I can do.
Yeah.
So that, again, we're instilling that trust back in us that was lost, so that they can continue to seek care with us at Advent.
Right, right. And feel like they were seen
Feel like
and
they were
heard.
heard. Yes.
Yeah.
Yes.
Can you share an example, without giving any details, obviously, how patient feedback did serve to improve a
Yes,
process?
I love this example. So our maternal child health department, when I came onto this role, there was a lot of feedback where, because we're a smaller community hospital, our cafeteria is not open 24/7. So if you have a baby at 2 in the morning, we're not cooking up pot roast back there.
No.
So
You got the machine to get
yeah.
something out of.
And if you've ever heard of a behavioral health sandwich, nurses will know this, but it's a sad piece of bread and a tiny piece of meat in a white styrofoam tray, and you might have a mustard and a mayonnaise in there. And that's what we were feeding our moms after they had a baby.
After they had worked so hard.
Yes, and we do offer some non-alcoholic champagne, some bubbly, and a free dessert.
Yeah.
But what we did is we took that feedback and then we elevated it. We put it in a clear container. We offered choices like chicken salad, tuna salad, added some lettuce on there, put it on a whole grain bun or croissant, added a fruit cup. So now your behavioral health sandwich now is elevated.
That's right. To something you want to eat.
A little more appealing, and it didn't cost that much money,
No,
right?
no.
We had to make a few adjustments, but that was a big one that's, right, it's about satisfaction. So, and I'll tell you now we've got Uber Eats and DoorDash.
I was going to say 24/7 you can get just about what you want.
You know, I feel like that happened, in the last year and a half or so.
Right.
So we've kind of, I'm sure the sandwiches aren't getting as utilized as much as they were.
Maybe not.
But, there's still some times where mothers don't have somebody to run out and get them food. So we have those choices, that option. And I'll tell you, I haven't seen another comment since then about our food specifically for that department.
Well, good.
Yeah.
So that's great. How does cultural competence influence patient experience? Why is that essential when you serve in an area that is culturally diverse?
Yes, we are in a very diverse culture. We're right outside the main gates of Fort Hood.
Absolutely, yeah.
So we have a lot of veterans and behavioral health issues with patients. And lucky we do have a behavioral health facility on site, so that's nice to have. But yes, it's very important because as you adjust, we can't use the excuse that we live in a different area or in a very diverse area. We have to change our perception, our verbiage, using scripting, things to be consistent with every patient every time, no matter what city you live in. So as it's because of our patients, that's why our scores aren't up, or our patients aren't satisfied because they're never going to be satisfied. Well, then how can we adjust or fix that as part of, and in most careers these days, you need customer service is very important.
Yeah.
And not only in nursing or healthcare, but it's very important to have that customer service, again, to make them feel seen, heard, valued. Very important.
Yeah. What are some small but maybe powerful ways that healthcare professionals can show empathy and leave a lasting impact on the patient experience?
I'll say, first of all, self-care, taking care of yourself. As healthcare workers, we can get we pick up extra shifts. There's bonuses offered, right? You're
motivated.
Whole world of short staff,
right?
But so not getting burnout. There's actually several studies, and I've recently read a book, Compassionomics. It's amazing. It's more, it's written by 2 physicians, but it's physician-based data for compassionate care, and it takes on average 40 seconds to be compassionate. And actually that fills your bucket that leads to compassion fatigue, as we call it. So combating that first, taking care of yourself, making sure you're taking your lunch breaks, letting leadership know when you're not getting those or when you're overwhelmed, very important in our setting. But again, pausing to connect with your patient, to see what they need, to see if they are more anxious, they're more nervous. At the end visit, we call it a transition visit, we're wrapping it up. Physicians in the ER are really focusing in on some scripting and to how, hey, we're glad you came in today. You didn't have a heart attack, but this is what you need to do. What questions do you have for me? Right? To make them, again, feel like they did the right thing because, next time when they have the chest pain, it might be a heart attack.
Right.
Right? And we don't want to instill fear or mistrust that they didn't do the right thing and come in. We want to ensure that, hey, you did do the right thing. You got checked out. And And, next time if, say the patient's blood pressure, they thought it was so high and it was, 140. Okay. Hey, educating the patient. Hey, really, if it's less than 160, you can stay home and communicate with your primary care provider. Because maybe they can adjust some of those medications or antihypertensive meds that you're on from the phone, right? Or from telehealth, versus coming in and waiting 4 to 6 hours.
Right. And I always think, because this time of year, when you go, every disease known to man is in that waiting room. It's like, I don't think I want to go to the ER because, people are sick.
Yes, and flu season, it's at its highest right now. So.
Oh, yeah, are you seeing a lot of?
Oh, we're seeing a lot. And, it's one place I would avoid unless we absolutely had to go.
Yeah, right. Your arm is broken. What trends or shifts are you seeing in shaping the future of the patient care experience?
I know you spoke about AI, but we've got, we have an app called MyChart. Okay, Ivan Health, we use Epic, and we have MyChart Bedside coming to the ER.
Okay.
We already have an inpatient. Our patients can communicate with our care team from the bedside. They can ask questions. They can talk about, hey, I need further clarification. I need a blanket, little things like that. I need a snack. But also they have access to their medical care, to their medical record. So say you're visiting an auntie or some family, and you need to go because you had chest pain. They can pull up their record, and the physician should be able to see it on their end too. But you can pull up records from in MyChart, Epic, and then hey, I just had a CT last month, or hey, this is what this showed, because maybe we need a comparison to something. So it's been really beneficial as bringing light to, hey, I just had labs done last week, and then the physician can, now that I see them, they bring them up, so they have that in their hands. So not only communicating with us, but having access to their test results, right? So you went into the ER, you're going on a vacation tomorrow, and you've come down, you thought it was a cold, but you're really thinking it's something else. So you go in and get tested, and usually you can see the results on your MyChart before even the physician gives you those results. Yeah. So whether it was flu, COVID, they run a respiratory panel, but you can get what you need before you get on your trip tomorrow. So it's been very helpful. We go live in the ER, and this is use your own device. So in the inpatient world, the patients all have tablets at the bedside that we clean and recharge and hand back to them. But in the ER, it'll be using your own iPad or own cell phone for access, but you'll have that same access that they do. You get to see your care plan. I do nurse leader visit, and I'll be like, who's taking care of you today? And they're like, well, right there, it's, Susie's taking care of you, and Dr. Smith, and this is the plan for today and what we're doing. We're drawing labs and waiting for that respiratory panel to see if you're sick. So, or to see if you needed maybe antibiotics, viral, usually you don't, but.
Right.
It's
right.
going to
I
be
think
great.
people have gotten to where they understand they're not going to give you amoxicillin
For
every time you go in. If patients or families could remember one thing when navigating the healthcare system, what do you think that would be?
So I would say to educate yourself, get educated, follow up, have a family doctor. That's very important. Patients come into the ER all the time for refills, and that's just not the place for that. We have opportunities with free clinics around town. It costs $20. A lot of places you can pay a cash price for a visit, which might be cheaper than you and I's insurance.
Right, really?
Honestly.
Yeah, for sure.
So just get yourself educated, have a primary physician so that they can take care of those minor medical needs for you. As in the ER, if you've had, pain for 6 months, it got really bad on Tuesday, we're addressing that really bad pain that happened on Tuesday, because in the ER, it's what's going on right now. So they'll be like, oh, my left ankle hurts and my knee hurts and my elbow hurts. And we're really not going to address all of those needs. And that's hard. And that's where some of that you really have to dig a little deeper and be more empathetic, so that the patient understands, right? The care that they receive today is based on this. And it's really important to have that follow-up. afterwards.
Yeah. Well, Advent Health Central Texas is very fortunate to have you, Kerri. And I have been fortunate to have you spend some time with me today to explain all this. So bottom line is, when you get those surveys, fill them out.
Fill them out. Yes.
It's important.
Feedback is a
that.
gift.
Yeah.
And I tell the team that all the time. We can't get better without the feedback. So
Right.
whether, you're adding it to your comment section or you're giving me a call after your visit, whether it was great too, right? We want the kudos and recognition as well, but we can't be better without it. It's truly a gift.
Absolutely. Thank you, Kerri. So stay with us. There is more of the show ahead.
I'm Eric the Travel Guy, and we're hitting the ground running in Waco, Texas. Get ready for authentic Americana in this charming town in the heart of Texas. Museums, family fun, family-owned restaurants with bold flavors, and eclectic shopping can all be part of your next visit. It's located just 90 miles south of Dallas along Interstate 35, and when you get here, you'll instantly understand why you planned this trip in the first place. You know, it occurred to me, you could pass through Waco on a day trip, but I suggest coming in the night before. That way you get a perfect fresh start in the morning. Now, they do have hotels, motels, B&Bs. I stayed at the Hilton right downtown and got an excellent night's sleep. Classic, convenient, perfect. The Waco Hilton upholds its reputation for spacious guest rooms and suites, perfectly appointed common areas, and excellent guest services and amenities. Go ahead and splurge and stay on the executive floor. Each year, about 500,000 people drop in on Waco, Texas. But in 2017, that number skyrocketed to more than 2 million. Why the jump? 4 words: Chip and Joanna Gaines. This is Magnolia. The popular HGTV stars helped put Waco on the travel and tourism map with their hit TV series, Fixer Upper. And you can see the passion and dedication to their design at Magnolia Market at the Silos. Inside, you'll find something for just about anybody. Shopping, design ideas, games, the garden, even a bite to eat. They've got one goal here: inspire you to own the space you're in. Oh, and here's another insider tip. Parking is complimentary if you park behind the complex and are on 8 between Webster and Jackson. It is worth noting that we are here in Texas, which means from time to time it can get a little warm. But here in Waco, the average temperature is a pleasant 66 degrees. For me, it's January, and that means it's a little on the cold side. Speaking of which, hey Siri, I'm in Texas. Why is it so cold?
Because Eric, the travel guy, it's January. Put on a sweater.
That's funny. She's funny. Thanks, Siri. You have a transition? Make the transition to the video. This is the Dr. Pepper Museum. Now check this out. The Dr. Pepper Museum and the Free Enterprise Institute is a history museum dedicated to telling the story of the entire soft drink industry, including Dr. Pepper, which was invented here in Waco in 1885. And for you soda aficionados, you will note that Dr. Pepper is 1 year older than Coca-Cola. You can take a guided tour and drop in on the soda fountain for my favorite, a Dr. Pepper float. This museum is housed in the original 1906 Artesian Manufacturing and Bottling Company building, built specifically to bottle Dr. Pepper, and is now listed on the National Register of Historic Places. The mission that guides their collecting and public interpretation is not limited to Dr. Pepper and its affiliated brands. As a matter of fact, they house and maintain the broadest collection of soft drink memorabilia in the world, including the Dr. Pepper Snapple Group corporate collection. Some of you may be wondering what Frito pie is. Well, it's a rootin' tootin' good thing you're watching this video. Yes, I said it. Here's what you need to do. I have your answer. You need to come to VTEX, okay? They've been around since 1915, believe it or not. And in 1983, they invented the Gut Pack. Now, this is a decadent combination of Fritos corn chips, hand-chopped brisket, sausage, beans, pickles, onions, and jalapenos piled high. The Gut Pack would later be named Best College Eats. Waco is classic small-town Americana, which means Getting around is pretty easy. Now, on this particular trip, we rented a car just to uncomplicate matters, but you've got to get on the complimentary trolley. It picks you up right at Magnolia Market, takes about a 15-minute ride around downtown, and gives you an ideal sketch of this pretty cool little town.
After your trolley ride, how about a cruise on the Brazos River? The Brazos starts in New Mexico and meanders all the way through Texas to the Gulf of Mexico.
You can probably guess what I'm going to say, but it's so true. No matter how much time you have to make a stop here. This is the Waco Mammoth National Monument. Now, it was named a national monument back in 2015, and wait until you see what is inside. It represents the only recorded discovery of a nursery herd of Columbian mammoths. Oh yeah, let's go take a look. When you take a guided tour, you can view fossils including female mammoths, a bull mammoth, and a camel that lived approximately 67,000 years ago. So plan on at least an hour or two. Whew, we are quickly running out of time.
My house has a new glow. I love my windows. Universal Windows Direct. I let in the sun rays. More of the heat stays. Universal Windows Direct.
Right now, buy one window, get the next one free, plus no interest and no payments for 24 months.
I love my windows. They've got that brand new home effect. Universal Windows Direct.
Ready for a better kind of primary care?
At Patient First Direct Primary Care, you get unlimited office visits with same day or next day availability.
And instead of rushed appointments, we take the time to actually listen.
There are no insurance hassles, just clear, simple care.
You can reach us by phone or text because access shouldn't be complicated. Our practice has expanded to include Medicare-age patients as part of our direct primary care model.
It's a fresh alternative to the traditional insurance or government-driven systems, care that finally puts you first.
For more information, go to patientfirstdirect.com.
It's football season, and we can create your outdoor tailgating spaces that is actually a part of your home. Bifold doors that tie in the inside and the outside, and you can gain anywhere from 1,000 to 5,000 square feet living space, all while taking in the big game, poolside. Call us at Gather & Co. Kitchen and Bath, where we can create your unique tailgating space.
Central Texas since 1889, TFNB, your bank for life, takes pride in being more than a bank. At TFNB, we remain committed to these principles. If you value them too, come join us. TFNB, your bank for life.
For over 2 decades, I've come to Allen Samuels shop, especially for trucks, because I've been very satisfied with the performance of those trucks. I think the strengths of Allen Samuels is obviously in their customer service and obviously taking care of your vehicle after the sale.
Like Allen Samuels always said, Waco has a lot to offer, and so do we at Allen Samuels Dodge, Chrysler, Jeep, Ram, Fiat. Come by, let's be friends.
This has been a Rogue Media Network production.